Hello, listeners, and a warm welcome to Views on Health. And tonight on the program is Dr. Charani Anuradha Abeyweera, consultant in psychiatry at the National Institute of Mental Health in Sri Lanka. A warm welcome to SLBC and the program, Doctor, after a lapse of 2 years.
Yes, it's nice to be back.
And for the information of our listeners, the topic under discussion today is screen addiction and social media's influence on mental health and well-being. I'll repeat that. The topic is screen addiction and social media's influence on mental health and well-being. It's a very important topic, a very vital topic, a very current topic, because addiction to social media is something that we know is happening day in, day out, 24/7 throughout the year. So a lot of people are having issues on account of this addiction. And to tell you about this important and vital aspect in our lives is Dr. Charani Anuradha Abeyweera, consultant in psychiatry. Over to you, doctor.
Thank you very much. Good evening. And thank you for giving me the opportunity to speak on such an important topic. It has become very important, and it's very well connected to our current world with a lot of technology. And I'm glad I can address this issue with the audience today. So, as an introduction, I'd like to say that technology is good if it's used in an intelligent way. So the reason we use all of this technology is to gain more knowledge and also to be in communication and in connection with the rest of the world. So obviously, technology brings with it its own problems. Throughout history, we have seen that. This is one of the issues that have come up recently, and it's ongoing for the past nearly 5 to 10 years.
Can I ask you, doctor, in your practice and dealing with patients serving the country at the National Institute of Mental Health, how often do you see patients with such issues being addicted to social media, and as a result, that addiction impacts on their mental health and well-being?
Well, it's very common. Most recently, adolescents, young children, and young adults come with screen addiction. So they present to us with depression or mood changes, behavioral changes, and disrupted functioning. And when we try to find the root cause, that's when we see, okay, there is screen addiction. It could be a cause. It could also be a way of coping with their mental health and with their well-being at that time.
So, doctor, how do they respond? I mean, what do you see first when you see the patient in their behavior?
Yes. So, for example, let's say a young adult came with their parents or their partner maybe, and the issue is poor communication between the family members, or a disrupted behavior, aggressive behavior, agitation. And the reason would be maybe the partner or the parents or siblings asking them to keep away their social media platform, which could be a mobile phone, internet, laptop, iPads, anything that uses technology with social media at this time. What happens is, because of the addiction, there are some withdrawal features, like you feel lost without it, you feel the agitation, you feel an unrest, and with that you get irritable, you forget to eat and drink, you forget all the not the online things, but the offline activities are disrupted. So that is face-to-face human contact, communication, everything else that we do, looking at nature, talking, reading, music, those kind of activities, yes. So those are all disrupted, and they come with a high agitation, conflicts within the family. Those are the presentations.
So, as a result of this addiction, they obviously they're antisocial. Would you say that, or not fully antisocial, but to some extent
I
they
would
may
say
are not
more
interacting?
avoidant. Yeah, more avoidant would be that.
Avoidance
Yeah,
of
yeah.
interacting with
Interacting. Yes.
people.
Yes.
How long does it take for one to become that
Addicted.
yes, addictive? Because I guess it's again like any ailment.
Yes.
It would vary from person to person. But at the end of the day, is there kinds of sort of like a common denominator that you could tell us? Is there?
I wouldn't be able to say a time period, but I'll have to say that the amount of time spent using your social media or your mobile phone, if it's 8 hours a day, it's very dangerous. So usually what should be done is it's for contact. And if we are using it more than what it's needed for, that would be addiction. And it would, so the reason why people get addicted is so what has happened is social media, the platforms have made it in a way that we keep scrolling, and that shows that we have more information. It tricks the brain and gives a reward system something to work on, and so the brain thinks, okay, this is rewarding, and then it keeps going on, and that creates a dopamine surge. Dopamine surge is what keeps the addiction going, and when you don't have it, you get less dopamine, and then you get very irritable and you need it again. So that's the kind of pattern. It depends. Some people can come out of it very quickly, some people can't. The way you get addicted is also kind of similar. So if you have similar addictions to psychoactive substances, gambling, or other behaviors, this is also one of those impulse kind of behaviors.
So this is very alarming, especially if you consider that it's the young people who I would say mostly prone to this type of addiction as against the older people. Am I right there, Doctor?
Yes, so we see it more in the younger generation, that is correct. But that isn't to say that we wouldn't see it in the older generation as well, because sometimes isolation plays a part in it. And if this is the way you're keeping yourself occupied and connected with the rest of the world, even in old age, even in middle age, it could happen.
A question which may not be fair because it's going outside of your scope of psychiatry. But looking at it all the time, wouldn't it affect the eyes? If they put on earphones, wouldn't it affect their ears? I'm just asking, Doctor, I mean, in the general sense.
Yes. So what you're saying is it's true. We do see that. So blue light is there. When on the screens, we have the blue light. It also affects our brain system and mood affect. So yes, that's through the eyes. And mostly you will have a person who is living in a dark room, and this is the only light. Where maybe very small letters or maybe moving figures, and that's all they're focused on. So it's too much strain on the eyes, and it can affect the eyes as well as the brain. And ears, so if you're using earphones all the time at a higher frequency, it could affect the ears. I'm not an expert on eyes and ears, but yes.
This is why I said it may not be a fair question, but as a doctor, it's a basic thing that you might be able to anyway tell us.
Yeah.
Because even as lay people, we know that it can impact on our sight, it can impact on our hearing, and from the ear, I don't know whether I'm treading into dangerous ground, but whether it can even affect your brains.
It does affect the brain. It does affect the reward system of the brain, as well as the circuitry in the brain. Yes.
So, Doctor, you see patients, you say it's common, and you see more young people as against the older people. Older people, I'm not saying, as you quite rightly said, could come up with these addictions, but the young people are the majority.
Yes.
So how do you address them? You also said that some get over it fast, some don't at all, or some may take longer. How does this work? Again, it's patient to patient, but in a general sense.
Yes. So for the younger generation, what happens is they have a social comparison. They have issues with this all came up mostly during the COVID lockdown. That's when we saw a lot of these issues. So we couldn't connect in a straightforward face-to-face, in-person manner, and social media blew up. That's where we used a lot of video calls or Facebook, TikTok, what else, Twitter, even YouTube at times. So what happens is they have a social comparison now. Am I using it? Am I not using it? How fluent are you in all of these? And then there's also this fear of missing out technologically. If you are not using it, are you going to be left out on the wayside, or are you going along with the trend of the generation, sort of? Issues such as cyberbullying and harassment also can happen. And as we keep talking about validation, addiction. So what happens is it creates a lot of anxiety, a lot of affect, especially depression, along with the addiction. And it disrupts the whole functional schema of the person. Addressing it is quite tricky. So some of the patients that I have seen, like I said, the partner or so I'm doing adult psychiatry, so that's why I usually see younger adults rather than the adolescents and the children. But then we see parents or siblings or partners of the patient or the person who I see who has removed this tool, the mobile phone, the iPad, or the laptop, and the person goes into a rage, starts breaking things, typical withdrawal symptoms of an addiction, maybe like an alcohol withdrawal, for example. And how do we address it? Because it is needed. You need to call someone, you need to call your boss, you need to send an email. And then on the other hand, you can't be using it day in and day out for more than a certain amount of hours. In child psychiatry, there's a chart from infancy to, let's say, 16 to 17 years, how many hours is scientifically accepted to use social media or mobile phones and things. So what we do is we address this. We try to motivate the person. So it's called motivational interviewing. It's used in substance use addiction as well. We can use that method. We can show them these are the pros and cons. This is how many hours you have been using. This is what has happened to your life. And where were your goals and where are your goals now? Those kind of discussions in length with the family, maybe without the family, alone. And then you have to sit and talk to them about their anxiety and how they're going to cope with it. It's kind of difficult.
It is a process.
Yes.
How supportive are the families, to the best of your knowledge? I mean, as they come with you, sometimes there may be somebody who has no family. Might come with a friend or nobody at all.
Yes. So usually our families, friends, our social network is more collective. So we have a lot of support. And they are also very good at being co-therapists. If you teach them what to do and how to do it, their expressed emotions can be handled, and it helps. So because in the clinic setting or maybe in the ward setting, which is rare, more in the clinic setting, what happens is we teach them, we talk to them, like I'm talking to you, telling you all the things under the sun, but then you have to do it, which is difficult. And that's when you need the support from your family members or your friends, as well as maybe journaling to see how many hours. So most of these mobile phones and iPads, they have this screen time. There's an app that can track it, and that can also help. There's a sleep mode in some phones. That means it shuts itself off. Technology also can help you. That's the tricky part. And sometimes if they are very anxious or depressed, medication can also help, like an antidepressant or an anti-anxiety tablet for some time, but not for a long time. It's more towards a therapy kind of outlook. That's what we're going to do.
Doctor, you speak of adolescents.
Yes.
They are in school. Can the school also help, the teachers especially? Because there can be a lot of peer pressure. Pardon me for saying this, but I'm not sure how much their peers can help them, because they also may be into it, or maybe the few who are not may be frowned down upon.
That's what happens.
You know,
yes.
why are you trying to stop?
Yes.
Let me do what I want to do. Or somebody will say, why are you interfering? I'm just only saying this
Yeah, those
hypothetically.
kind of
So that type of thing can happen. But then the teachers perhaps may be able to play a proactive role. In which case, how do they do it? I mean, are they trained, or do you need to train them? How does that? How should it work? In your opinion as a consultant psychiatrist?
So teachers are like the second parents. That's what we consider. So these kind of behaviors happen at home. They observe the parents, imitate. It happens at school as well. So if the teachers are young and they are also into social media, it's going to be difficult. And yes, we do need social media. We do need to learn these IT technologies and things to go forward in our lives. But where are we going to draw the line? So there can be some meaningful discussions, open discussions, and also making the children or the adolescents aware of what's happening, making the family aware, the parents. Parents may also not know what's going on. So awareness of mental health issues and screen time, screen addictions, that's important. I don't know whether the teachers have been taught these or whether they are aware of it, because like I said, I'm mostly doing the adult psychiatry, so I cannot say for the child and adolescent populations. But if there is a vigilant, responsible person, they would consider it, and maybe they can get training to teach these.
Doctor, would you say that if a person looks at the computer, it's a bigger screen, and I've seen people do this, and they go into YouTube on the computer and then they're watching. Is that better than doing so on the phone?
Either way, if it's unnecessary, either way, if it's like
too much of it.
If it's not necessary at that point in time, and if it's not going to help you, it wouldn't be. It's more like entertainment. And if you're at work, you cannot be in two places at once, at one time. Yeah.
And talking of work, there are some people whose days are spent in the office, or they're working from home, and they have the computer, be it a desktop or a laptop. Yes. They have to. That is their job.
Yes.
That is not social media I'm talking about.
No.
I'm just digressing for a moment.
Yes.
They are actually working.
Yep.
How is that in comparison to the addiction part of it?
Okay. So like I said, social media is, if there's a meaning, if it's meaningful, if you're gaining knowledge, if it's your leisure time and you're being entertained by it, I wouldn't see it as a wrong behavior. So when you're at work, this is needed. You need the technology. You need to be in front of the computer. I use computers. We have to use computers for research, for report writing, studies, everything. So the way we use it is the important. That's where it's important. Where are we going to draw the barrier or the boundary between work and meaningless activities? Meaningless activities that are more rewarding to the brain but are not actually rewarding in real life is where the addiction would come in. Rather than if you're actually at work, you do need a break. You know when to clock off, even if you are in front of a computer.
So what would you say if an adult who's spent a good part of her day in front of the computer, purely work, now come evening and then I want to relax. I think I should watch something, a movie.
Yeah.
Then you're still on watching the screen.
Yes.
As against maybe going for a walk or going to swim or whatever, even just meeting somebody and having a coffee or a tea, which is totally out of the screen.
Yeah. Yes. So that is the nature.
Then it continues.
Yes.
I mean that.
That's the nature of our modern lifestyle, which is where we should actually be aware of what our behavior and what we're doing. It would be nice if we could go for a walk, have a coffee with a friend, after work drinks, as in like, I shouldn't be promoting it, but it's like social gatherings, talking to each other, and relaxing in a way that's not a meeting around a conference table, sort of. We don't have those kind of opportunities all the time. So watching a movie once in a while on your screen after work, it shouldn't impact your day-to-day lifestyle. But if this is, it could also be a routine, because I remember when we were younger, and even now sometimes, after we go home, we have our dinner and we watch a whole lot of teledramas. And yes, this one-to-one after, and that is, it's like a marathon. So again, which one are you going to watch, and which are you not going to watch? Are you just going to watch the screen? So we have to be aware of our behavior and what it's giving us. If it's not giving us pleasure, if it's not entertaining us, if it's again meaningless and we're just glued to it, that is where we would have to stop.
So what is the negative side of this, the worst case scenario? I mean, it is negative in the sense that they can be quite antisocial, as you say, they can be withdrawn, or not even know what's happening around them.
Yes.
Some of them tend to even skip meals or eat late, because what is going on the screen is more addictive. Or it's I would say tastier.
Yeah.
In quotes, as against stopping that and going and having your dinner.
Yes.
So worst case scenario, doctor, does it lead to anything like maybe, God forbid, suicide? I mean, self harm?
Yeah, it does. So if there is family history or genetic loading for psychotic illnesses or affective disorders, those could be triggered by the content you are watching or using at that time. And also, like I keep saying, it disrupts the family or the functioning, the dynamics, all of it. So there you will have a social drift. You're not aware of what's happening. You're not able to get your goals. Like if it was a university student or let's say an A-level student who wanted to go for higher studies, and they are not geared for that. They're not following their work placements, assignments and things. They're more towards the social media or interacting online, rather than going ahead and doing their assignments and furthering their life. So that would cause lots of issues, and one day when they wake up, they're not where they wanted to be. That could cause depression. There could be psychotic symptoms, given the conspiracy themes that sometimes crop up in the social media. And when you're into it, this is what you believe. You're not in contact with the real world or the reality. Those can happen, and anxiety is increased. Yes, so there are lots of suicide. When you say that, there was an online game some years ago where when the young adults or the adolescents, that was the age group that it was targeted for, they couldn't achieve a goal, or they couldn't end the game. It was task-based, like a strategy kind of a game. And when they couldn't do that, there had been several suicides. So it could happen. Self-harm also may happen if you're using it too much and you're immersed in that's the world for you, or if it's taken away from you.
So how do you address this situation to help them get out of it?
There were social media bans in some countries recently. That is one way. It's drastic, but it could help. Also, limiting the screen time, making sure that someone responsible is able to see what you're doing. If it is a school-going child, an adolescent, or a young adult who is at home, the parents could be not not a very strict monitor, but have to know what's going on. And what we say is the computers or screens should be in a common area, a family area. The time used is also It should be like, how many cartoons are you going to let your child watch, or how many teledramas are you going to watch? The same. It's the same. If you're giving someone a deadline, it's only half an hour. You should also be able to say, okay, I'm also only going to watch one teledrama for half an hour, and that's it. And then you have to create the family connection through. We always try to say the meals have to be together, not sitting alone in front of the TV or the computer, but more together, so that you have a conversation, you can discuss your problems or what happened in the day, and that communication builds, it's more stronger relationships, less towards what's happening.
Would you prescribe medication?
Sometimes, yes. If there's a anxiety disorder, if there are suicidal ideation or depression, psychosis, then yes.
It's necessary.
Sometimes, yes.
And of course, like anything, it varies from patient to patient.
Patient to patient, but not for the screen addiction, for the result or the psychotic or affective component of it.
That's actually focused on the well-being of the person.
Yes.
Thank you, Doctor. What's your take-home message?
To be aware of what we are doing in our daily lives, to make a priority of what is important to us and what's not important. Is the screen more important than your daily life and your connections with your family and the social context? And also, how detrimental is it to you? Or is it helping you? Yeah.
Thank you, Doctor. And on that note, we end this very interesting discussion on screen addiction and social media's influence on mental health and well-being. A very timely topic. Thank you to Dr. Charani Anuradha Abeyweera, consultant in psychiatry at the National Institute of Mental Health in Sri Lanka. Thank you so much, Doctor, for being with us.
Thank you very much.
And for sharing your valuable insight into this very vital topic that is affecting not just people in Sri Lanka, but the world over.
Yes, thank you very much.
My thanks also to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.